All right, well, something a little light here, but the idea here is that you need to, you need to get screened and see physicians who do the screening. And
I knew Bob would like that one.
I can relate.
so let's talk about screening. So some of the viruses that we spoke about cause cause tumors down in the privates area, and that's where a good physical exam comes in. So no one likes parading around in their birthday suit, but I think transplant recipients should take it all off and have the doctor really check them from head to toe, because what is a small problem can be picked up early on and treated very successfully. Ultrasound of native kidneys, so we talked about that already. Particularly kidneys that have a lot of cysts in them are prone to developing cancer. Cysts are collections of fluid. They're not solid masses, they're fluid masses, and those, some kidneys have a lot of cysts. And so that's something that your transplant team will consider when they decide whether or not to recommend ultrasound surveillance. If they do recommend it, it's usually done on an annual basis. The benefits are ultrasounds don't hurt, they're non-invasive, they're not that expensive, and if a kidney cancer is picked up early, it is treatable with a very high rate of success. And here we're talking about removing a kidney that's not functioning to boot. So, by and large, cystic kidneys benefit from having ultrasound, but this is something that you should ask your transplant team about. It's useful for some and less useful for others. It's certainly important for women to have their Pap Smears, because cervical cancer is a higher risk and is related to viruses in the transplant recipient population, so annual Pap Smear is important. Prostate, we don't know what to do about prostate screening in non-transplant recipients. It's all over the place, and so I'm just not going to comment, certainly not on a video, except to say, ask your doctor. But this isn't a much different situation than in the general population. Colon cancer. So I think this is one that is really important to keep up with, because colon cancer starts as polyps, and polyps are removed, and if polyps are removed, you don't get colon cancer. Simple as that. So the risk of colon cancer in a transplant recipient is about twice as high. It's not as high a risk. It's not as increased a risk in a transplant population as some of the other ones we've talked about, like skin and lymphoma, but it's twice as high, and it's just so easy to get a colonoscopy. That's relevant to patients over the age of 50, maybe younger if they have a family history of colon cancer. We can have stool check for blood, but really in today's day and age, colonoscopy is the way to go, and that's not controversial.
Why? It seems like the need for colonoscopies has gotten extended at times.
Yes.
And why is that? Because when I turned 50, my GI said, "Oh, for you better go every 3 years," and then
Yeah, that sounds good.
And then all of a sudden it's like, "Oh yeah, you're good. Come back in 10 years."
Yeah. There are several reasons for it. The scopes and the proficiency of the endoscopists have gotten really good. So, the optics didn't used to be as good, and the way the preps are so good these days, and the optics technology and all are so good that you're pretty darn sure when you have a competent endoscopist do a colonoscopy, get through the whole colon and come out, that there's nothing there when they're done. That's part of it. There's a balance when the task forces recommend standards for this sort of thing, because there's an effort to balance the improvement in health with the costs. So, it's cheaper for society to have people getting scoped once every 3 years than every year. I'm not advocating that we would get a colonoscopy every week, but I would say that with most of these things, there's a range, and as a transplant recipient, you ought to steer towards the more frequent part of that reasonable range. That would be my rule of thumb. Liver cancer. We had a question about that before, and transplant is very, very successful in treating many liver cancers, but it's important to have screening after the transplant as well, because it can come back. Even though you take the liver out, the cells from the liver cancer might be circulating through the body of the recipient. Their immune system's good enough to kind of keep it at bay, but sometimes one of those liver cancer cells will get back into the new liver, and if we pick it up in an early enough fashion, we can prolong life. So we've talked about kidneys, we've talked about the gynecology exam and full physical, colonoscopies. Certainly people who have any kind of prior smoking history ought to get their chest x-ray at recommended intervals. And we're going to talk about skin cancer screening a little bit later. And these are general guidelines. Obviously, we have people here who have had different organs and a different history from different programs, and so I can't give you a piece of paper that says this is the hard and fast rule about what you ought to get every year. It's something you need to talk about with your team. But these are general guidelines. And again, I don't think it's so valuable to worry about cancers after transplant, but I would be pretty obsessive in keeping your appointments. The longer you get out of transplant, maybe the more comfortable we get. But it's really, if there's an area to be worried about, it's a couple of months have gone by beyond when you're supposed to keep your appointment. We're all busy. I don't always follow up for my health and well-being appointments without being tardy at times. This is an area where, especially a transplant population, ought to probably be a little obsessive and keep to the schedule.